I think with any treatment in any disease, you have to talk to the patient and see how they feel. Regardless of what it might look like to you, the way it impacts them is a bigger factor in how you're going to treat them. If you think you have alopecia areata, it's wise to go see a dermatologist so that you can get a proper evaluation. Treatment for alopecia areata varies depending on age, location, severity, and any other medical conditions that might affect the treatment. So the most common treatment for alopecia areata is steroid injections. It's been around forever. Topical steroids generally don't work well because the scalp skin is too thick for the steroid to reach the depth of where the disease is taking place. Topical minoxidil, if someone is starting to regrow, can be effective, and there are studies showing it can help. But if someone has an active autoimmune process going on, it's not going to stop that inflammation. Oral steroids have a lot of side effects. Although they can work, it's not a good long-term solution. So the standard of care has always been steroid injections. There are better treatments now. The most important class of treatment that we have now is JAK inhibitors. JAK inhibitor stands for a Janus kinase inhibitor, and we can give them both orally and topically. Before JAK inhibitors, we didn't have a way to target the immune pathway that was causing the issue with alopecia areata. With JAK inhibitors, we can control the condition better, and we can alter the dose so that people can stay on low doses for long amounts of time and achieve long periods of regrowth. We move to JAK inhibitors if it interferes with their life. It's certainly on the table. You can have someone who has just eyebrow and eyelash loss, and it doesn't seem like a lot, but then they can't participate in activities of daily living because things get into their eyes. There's a reason, that we have eyebrows and eyelashes, and without them, life is pretty hard. It depends on their comfort level and how much it affects that person. So it varies patient to patient. I think it's really important for people to take care of their mental health because it's a very distressing condition. And I try to get my patients to put their faith in me and relax and let the treatment work.